Assalamu alaikum, the communication day. First scenario, Mrs. Sophia Adam, she's 18 years old, woman who is trying to become a professional model, has had her second grand mal seizures in the last 3 months, which was witnessed by her GP. She has had a normal CT hit and metabolic causes have been excluded. She has returned to your outpatient clinic for the result. Please discuss the diagnosis with her and address her concern. Are you ready? Dr.
Okay.
Salma?
Okay.
Okay, here you go.
Hello. My name is Dr. Dr. Abdurrahman, the doctor in the clinic today. Are you Miss Sophia, and your age is 18?
Yes, I am.
Welcome, Miss Sophia. So we are here today to discuss some issues regarding your health condition. Are you okay with that?
Yeah, okay.
So before proceeding further in this discussion, can you tell me how much do you know about your health condition?
I don't know much. It's happened twice in the last few months.
Mm-hmm.
I lost conscious and for a while, and when I come back, I found urine and I found blood in my mouth. I don't know what happened. And you said you are doing some brain tracing and imaging and investigation, but I still don't know what happens to me.
I appreciate your knowledge about your condition, Miss Sophia. And I'm so sorry for what happened to you. Are you okay today?
Yes.
Okay, that's great to hear. So, Miss Sophia, what is your expectation from our meeting? What do you expect?
I expect you to find what's the cause of this, because this has ruined my job. I am looking to be a model. I'm afraid now to get this situation in my job. It will be embarrassing for me.
Mm-hmm. Okay, Ms. Sophia, your concern is valid. I appreciate your concern. And let me just explain to you. And firstly, I will just explain to you the test results. So your test results are here with me. And according to your condition that you have fits, and you also recall that you injured yourself after the fits and you lost your consciousness, and an image for your brain has been done, and the result of this image was normal, completely normal. Also the other test results was normal. So, Ms. Sophia, I want to ask you how much do you know about this fits? Have anyone before explained to you this condition?
No, what's fits?
Mm-hmm. Okay, so you experience some type of abnormal movement of your limbs, and this was witnessed one time by your GB after losing your conscious level. And as you discuss also, you experience some injury in your mouth, and you found blood in your mouth, and you also pass urine after this involuntary after this episode. So these all symptoms manifestations that you experience called epilepsy. This is the medical term of your condition. It is describing an abnormal electrical activity in your brain, causing these manifestations. So the investigations.
Doctor, you said your investigation was okay. You
Yeah,
didn't find anything.
I appreciate
How
your
could you
concern,
be
Miss
sure
Sophia.
about this diagnosis?
Yeah, I appreciate your concern, Ms. Sophia. So the investigations was done for you was all normal, but there are other causes for this to happen, like your mood, anything affecting your mood, like you sometimes some other. Let me just before explaining these things, I want to ask you some questions. Are you okay with this?
Uh, I think you might be wrong. Might be due
Mhm,
to my dieting. Is it
mhm.
because of my dieting for my modeling practice?
It is one of the causes, but fortunately, in your case, they did for you the investigation for this to find out about this, and it came also negative. So that means it's not about your dieting. It's not about your diet. So they are we are still uncertain about the cause, and you need to be to be re-evaluated again for other possible causes for this condition. Like Miss Sophia, I want to ask you some questions just to clarify some things. Are you okay with that?
Okay.
So, Miss Sophia, what about your mood recently? Are you feeling anxious about this job, the modeling, the new job?
No, I'm very ambitious, but after these attacks, I'm now feeling afraid to do my job because of these attacks. I will how I will know the attack it will not come again.
Mhm. Don't worry about that, Miss Sophia. We are going to take care of you, and after finding the specific cause of that, a team of specialized doctors will take care of you and give you the management for that. Uh, uh, so don't worry about that. So you said that your mood is good and you are not anxious. Do you smoke? I'm sorry to ask you this question.
Yes, I'm a smoker.
So how many cigarettes per day for how long?
About 5 to 10
hmm About five
since
to 10.
about 3 years since
Mhm,
my teenage.
mhm. So smoking is bad for your health, and I advise you to quit smoking. If you are able to do that, that would be very great. If you are not, I can guide you to the smoking cessation department to help you. Is it okay with you?
Okay.
Okay. So, Miss Sophia, do you drink alcohol much?
Not too much, but
Mhm.
sometimes I drink alcohol in our job and when we are do a meeting with our international colleagues.
How many units average?
And sometimes I stay 4 months without drinking. But
Mhm,
when sometimes I drink 3 or 4 bottles, cups.
mhm. Okay,
Yeah.
okay, okay. That's okay. So, Miss Sophia, do you drive?
Yes, I'm driving.
Okay, so I recommend you to stop driving because now
I
we
can't. There is no one to drive me, and sometimes in late nights we finish our practice. I
Mhm.
can't stop.
I appreciate
Too
your
many
concern,
flights.
Ms. Sophia, but your health is a priority, and you can have these seizures at any time. If you have it while you are driving, this is endanger your life and the life of others in the street. That's why I highly recommend you to stop driving and to inform the DVLA because you need to protect yourself and the others. Is this making sense for you?
Why you are going to tell DVLA?
I recommend you to inform DVLA because since you are having this condition, which is seizure, and this is unpredictable, and still now you are under investigation and evaluation to know the cause. So we cannot predict if this happened to you while driving. This will endanger yourself and the others. That's why I highly recommend you to stop driving and inform the DVLA. There are some rules for that, and if anything happened, the DVLA actually, because I'm going to document this, but I'm not going to inform. You are going to inform by yourself. So this will make you endanger your life. Is this now make sense for you?
Okay, might be. I will go next week.
Okay. Okay. Uh, so, Miss Sophia, um, do you have any other concern?
Yes.
Yeah.
Is this
Feel free to
curable?
tell me. Mm.
Is
Uh,
the disease curable?
Unfortunately, in this point, I cannot tell you anything. It is controllable by some bills. Don't worry about that. But about the cure, we are still waiting to know the reason behind this. After evaluation, after thorough evaluation, and they will sit with you and tell you the exact reason and the future for this disease. Okay? Is this okay with
You
you?
you mean you will start you will not start treatment until reach the cause?
They will start treatment, by the way, regardless of the cause. That is a valid concern, and thank you for raising this question. Yes, they will start treatment, by the way, because you have two episodes. And the most important thing that I have to remind you with, that you have to take care in your house about the furniture, the things, not to fall down, not to injure yourself, and try when you using bathroom not to close from inside, because sometimes these fits can happen to you and you need help. So it will be easy for others with you in the house to come and reach you easily. Is this okay with you?
Okay. And what about my
Mrs.
Okay. Time is up.
What again?
what about my pets? I
Say,
keep pets in the in my house. Can I stay keep still keep them?
mhm. Pets in your house? Yeah. So
Cat.
I
I
believe
have cat.
you have a cat. I believe there is no problem of keeping your pets and taking care. With whom you are living, Miss Sophia, actually, beside this your
I live
cat?
alone.
You live alone. Is there any family member nearby, or somebody can accompany you?
And sometimes I stay with friends.
Mhm. That's very good. In the first, before starting the medication and make sure that you are safe, it's better to have somebody with you in the house, some friend or someone. Otherwise, we can inform the social workers here to see if how they can help you. Is it
I
okay
am
with you?
separated from my husband now, but
Mhm.
mm, I think we might come back.
That's great news. I'm glad that you are thinking like this. Husband will be a good company with you. So, Miss Sophia, do you have any other concerns?
I think time is up.
I want to know
Okay, last
how
concern. Okay,
okay, finish.
Okay,
just for teaching.
okay,
Go ahead,
okay.
doctor. What's the last concern?
Last concern. I want to know for how long I will stay without driving if I inform
Uh-huh.
the devil.
And normally in this situation in our practice, I'm sorry to tell you that, but it's up to 1 year from the last episode that you have. Then they will do re-evaluation for you again. But I believe that you need to talk about this with the DVLA. They are going to update you with the recent and new rules. Is this okay with you?
Ah, okay.
Okay, so I'm going to give you some brochures and leaflets about the epilepsy to read more about that and about the precautions that you need in your life, and hopefully this will help you. Is this okay with you?
Okay, thank you, doctor.
Thank you.
Okay. Okay. Thank you, Dr. Ibrahim, for a very nice scenario first and tricky one, and
Yes.
also for
I
the
don't know if
concern.
I don't know if
Yeah,
it
Shall
is
I
answered
start
yeah,
to
we
now?
you.
will tell you now. We will tell you now. But you did great in some parts and you missed other parts. But it's okay. In general, you did great, Dr. Salman. But I want
Thank
to
you.
thank Dr. Ibrahim because he raised the all possible concern in this scenario. This is what I need to do. Really, I need a lot of concern because in the exam, it's not the issue that you will talk. No, maybe the surrogate he is the one asking you, and you will address accordingly, one by one. So I need from the surrogate to prepare good concerns and the common concern that it might come in the exam. Okay, let's
Okay.
hear Dr. Ibrahim comment, then I will comment. But in general, you did great, Dr. Salman. Let's hear him.
Okay.
Before comment, I want to ask you, was you there yesterday with Dr. Ahmad?
No, I didn't really. I was outside. Sorry.
That's good because I will post his scenario. Okay. Okay.
Yeah, it's okay. Yeah.
Okay.
Okay.
Let's start first of all. Epilepsy, you can say it's a clinical diagnosis usually. When you don't find the cause, you will treat it as a clinical diagnosis and you will start a treatment. And already we are finished investigation in the scenario. You shouldn't say we will do another investigation or something like this. And second thing about the informing of DEVLA here, I might be dangerous for the community, and you should inform DEVLA. I think not me to inform DEVLA because I said to you, I will do next week, and you didn't I even ask me who will take you home. Might be I'm having my car now and I'll drive it to home. Okay. And the third
Okay.
thing, I
I was
try.
confused about that. Thank you for clarifying. So we should say that we will inform Devla.
Yeah, okay, and the third
Okay.
thing is about the pregnancy. I deliberately told you I have husband because you should ask about the pregnancy and because of side effects of drugs. This is very important in epilepsy scenarios. Future any planning of pregnancy or if, any possibility to be pregnant now because if you're starting the drugs, most of these drugs has effect on the fetus.
Yeah, thank you. Yeah, I missed this. Thank you.
And also, you didn't ask me about the hobby, and this is important. I am swimming. I
Mm,
didn't tell you. I go to swimming.
mm, mm.
It might fail you.
Yes, yes.
And anything diagnosis like this, you should ask about any hobbies might be dangerous for the patient. I might die tomorrow because I am going to swim.
Mm, that's right.
Okay.
Okay, thank
Perfect,
you.
Dr. Ibrahim. Anything else? Any other comment or Dr. Ibrahim?
I finished, I think.
Oh, okay. Okay. So let me start the comments from the introduction, Dr. Salma. The
Mhm.
scenario, I think it was like a clue for you. They wrote up the scenario epilepsy. So it's epilepsy. And you said epilepsy, but you start to say fits initially. I don't know why you said fits. So for me, if I would do this scenario, I will start by breaking bad news. For me, this is also my humble opinion.
Mhm.
Epilepsy as a disease, it might stay longer with the patient, right? So I can do it
Yes.
in a breaking bad news way. Why? Because it might harm her job, her occupation, her even hobbies. So the best way
Mhm.
to start by saying, I'm so sorry you have a condition called or sadly, I'm afraid to say you have a condition called epilepsy. Have you ever heard about it? And continue the others. Before that, of course, you will say the results are with me now. Yes, the CT was okay, but there is something concerning, which is epilepsy. As Dr. Ibrahim said, it's not radiological diagnosis, and also if the scenario mentioned no metabolic cause means something related to the epilepsy itself, it's not a metabolic cause. So here, as he said, as a clinical, and only need to be, as also some doctors ask initially, to do EEG, which will confirm the diagnosis. Yes, you will do
Yeah,
further
that's
tests.
why.
Yes,
That's why I told
but
her a further test will be done for you,
but
because I
still
was
it's
putting,
epilepsy.
yeah, in my mind, withdrawal from alcohol and from any illicit drug. I
Okay, you
forget
can
to ask.
explore this. You can
Yeah,
explore these things, but it was written witness
an
epilepsy and
EEG. Yeah.
and the EEG showing, sorry, no EEG. There is confirmed witness or witnessed by the GP, and she told you I lost my control and blah blah blah. So it's
Yeah.
a clinical seizure or it's a clinical diagnosis as mentioned, and this is epilepsy and epilepsy. You have to break bad news and continue as I mentioned. Okay, it's diagnosed already. What to do? Just to roll out. We already rolled out, but the EEG to confirm, and also still the diagnosis is already decided by our consultant in the best interest for your condition. Okay. The other things, as Dr. Ibrahim said, you have to explore the hobbies. The pregnancy is very important. So please, 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 anyone has female in communication before starting, put pregnancy in a circle because it might be a concern or it might be a hidden agenda. So what you will do, try to encircle it and to talk about it in coming points. Okay. Sorry, is it okay now, Dr. Salma? Clear? So the
Yes, it's clear.
pregnancy, yeah, the hobbies.
Yes, it's clear.
The good thing you remember at the end to talk about red flags or safety netting. Don't be alone. Don't leave yourself in a washroom, closing, locking the door. The swimming here, either to ask it particularly as a question. Do you swim, or you can do it as safety netting, please. If you are
Mm.
doing swimming, please have an company because it's endanger your life. You might have this seizure or these attacks while doing the swimming, and it might harm also you. The last point about driving, what you did perfect, but when she said after week, I think this is also it was over estimated by the surrogate. I mean, he already she mentioned to you in the exam they will not argue with you about that unless it will be instructed by the examiner. I mean, whenever you will tell him, please inform the DVLA, either he will say or she will say, yes, okay, I will inform. Then the point will be passed, or he will argue with you, but not to tell you, no, doctor, I will tell you, I will tell them or I will inform them in the next week. I think it might be like, I don't think the surrogate will do it. Anyway, let's learn the lesson. If she said to you, no, doctor, I will not inform them now. I will inform them after a month or whatever. You can tell her, please, it's in danger, as you try to convince. So I don't think it will go beyond this limit.
I
So
tried to make her
yeah, yeah, I
afraid
get
by
you.
saying that I will document it, and
Yeah, yeah,
the
yeah.
DVLA, if anything happened, the DVLA will revise our like this.
So I agree with you, Dr. Salma. He
Mm.
will or she will not go to this details. I will not after 1 week and so on. It will
I
accept
think
or
in epilepsy, even the doctor should inform Devla, yes or no?
no, no, no. After convincing the patient, if the patient accepted and he said, okay, I will, that's enough.
Uh-huh.
But if he insists, no, doctor, I will not, this is my job, I am driving, I'm dependent on this, that time you will tell her, I'm so sorry, I can breach the confidentiality and I will inform DVLA. Why, doctor? It's my job. I am worried about your health and the health of others. Whenever you breach these rules, you break these rules, you might harm yourself, and your health is precious for us. This is the way how to do. But she will argue with you for 1 week. I don't think she will say that. No, if she want to insist and to argue with you, she will say, no, I will not tell them I want to drive. I will not tell anyone like that. But for 1 week, I don't think they will fail you if you didn't tell her, no, 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 stop right now. You have to inform them now. This is the point.
I did this because
Mhm.
I doing what the patient usually do to escape from the responsibility. Okay, I will
No, no,
do.
no.
But,
If they want Dr. Ibrahim to escape from the responsibility, as you said, they will say, no, I will not inform them.
uh-huh.
That time, that time you can say, as I said, I'm so sorry. It's my duty now to breach the confidentiality because you didn't follow the rules.
Dr.
But
Basim,
yes,
before I ask this question to one of the mentors, I told him, do I have to breach the confidentiality and tell the developer by myself? He said, no. You just tell the surrogate that you are going to document this, and unfortunately, if anything happened to you and you didn't tell Devla, it will be against you in court or anything. But don't tell that you are going to tell Devla because this is not
okay,
your rule. So I'm not
yes.
sure now.
But if you will wait, and he or she might drive, he might have
Mm,
the accident and he might die or she might die, and you will be the one
mm.
responsible, right? You will wait
Yes,
for him to inform Devil A that time?
no.
Of course, no. You will inform
Not
Devil A
like that,
because,
Dr. Bassem. Just no, you are not the one breaching this. This is a
yes,
department, or this
Dr.
is
Aisha,
a special. Yeah.
I said if he or she insists not to until, I'm not saying I will inform them from the first option or first as a first option. No, I said if he or she insists to do so, even after my warning, please inform them. She said, no, I cannot. Then I told her, no, please, it's against the rules.
You
You
can
will
say
be,
by another terms like that
what do you think?
we are all under the law, and we have
Yes.
rules regarding that. And I'm sorry to tell you that is the hospital will take action regarding this issue if you will not tell the DVLA.
Yeah.
I believe if the task to negotiate with the patient, it might reach to this level. But if the task about epilepsy and counsel about the disease, they will not go
I
to this
did hear
level.
that someone has
Yes, I
to say that in the
exactly,
exam because they will
exactly,
not let you tell this point because
exactly.
yes,
I
not
agree
an
with you, Dr.
argue.
Aisha. But
Mhm.
once we raise this issue in a
But you should
meeting,
know that
tell
this
him
is the rule. You should tell
exactly,
if the patient not tell like
perfect.
that.
So we have
Yeah.
to know if we face this in exam or in a scenario, and you didn't practice it before. This is the way how to do it. Because if you let the patient drive after you warn him, and he might have an accident because of attack, it will be your responsibility. Why you didn't tell him that I should inform DVLA and I will breach the confidentiality. Now the patient or the law or the confidentiality. You are worried about the confidentiality, right? Or your job. Okay, what about the patient health? He might leave you and go to drive, insisting to drive for 1 month or whatever without informing DVLA. So you have to tell him and negotiate with him. I should inform if you will not inform. But if he said, okay, doctor, I will do, full stop. خلاص, no need to discuss it more. You got it? I'm talking about negotiation. I will not inform. You warn him once, twice, still he's insisting. That time you can tell him it's my duty to inform DVA because your health is precious for us as well as other lives. Because whenever he had accident, it's not his problem only. It might endanger others, right? Okay, clear now? And as Dr. Aisha said, it will not be to this deep details in the exam. They will either to raise it and to ask him to inform DVLA, and he will say, okay, doctor. if the task to negotiate with the patient about driving, and I think there is scenario about stroke to talk about driving. It was, I think it was the last night or the night before the last night. Maybe the scenario will go to this level because it's the task about driving with a stroke patient. What do you think? You will tell him stop driving. He will tell you, okay. So what is the scenario will be? What the discussion will be? Of course, it will be some hidden agenda about negotiation. No, doctor, I will not DVLA. I will not inform. Then you will ask him again. He will not be convinced. Then you will tell him, okay, I will arrange a meeting with my consultant and blah blah blah. So it will be like a refusal. How to convince the patient and how to negotiate about driving. I hope it's clear. Sorry, is it clear
The
now? Okay,
No,
go ahead.
Salah.
about contraceptive pills.
Hmm.
She also, I think she should ask because of drugs. Most of drugs for epilepsy are enzyme inducer and might affect
Yes, exactly. Yeah, she will use another mechanical or another safe protection.
safety. Yes.
Yes, exactly. And by the way, what's the medication safe in this scenario for the pregnancy and epilepsy?
Then,
Dr. Salma, this is for clinical judgment. I mean for long clinical consultation. No?
Yes, I
Yes?
am with you. I forget.
Lamotrigine.
Yeah,
Lamotrigine.
lamotrigine, yes.
Yes, remember it.
Uh,
Yeah.
Thank you for giving me the chance to practice really, because before that I was preparing this epilepsy perfectly with myself, remembering the pregnancy, hobbies, everything. But
Yeah, but when you practice,
when you practice,
exactly,
everything is different, really.
everything evaporated.
Thank
Really,
you
this is,
so
yeah,
much. Thank you.
this is what I'm always advise.
Mm.
Please
Yes,
do practice because whenever you practice, you will have a scenario. Once you practice a scenario, you will never forget it. But if you
yes, that's true.
listening, yes, it's okay to hear and to know and to write, but once you apply, you will never remember the all details. Yes, you might remember the most important, but you might miss these details which can give you the full mark. Okay? Any comment or question?
Assalamu alaikum.
Alaikum assalam. Yes, Dr. Rashid.
You are right. I agree with you. What you, Rayak, I agree with you. But if the patient insist to drive and in spite of full explanation and like
Mhm.
that, you need to explore more with the patient. Why he insisting? Maybe he needs some
Yes, I agree.
some help for.
Yeah, she already
Yes,
said
yes.
because
Perfect.
she already said I don't have a driver. That's why I
Perfect.
didn't ask.
Yes,
I was thinking to ask why, but then he said immediately because I don't have a driver.
yes. If you solve his problem, I think
Mm.
he will agree at the end to stop
Mm.
drive.
In this situation, how I will solve it, her problem?
Social worker.
Social
Yes,
work
Social
can,
worker.
yes,
yes.
Yeah, social workers.
and
Okay.
most likely there be a hidden agenda for this point. If he insisting like that, in spite of full explanation like that, he is keeping something in his mind.
Mm-hmm. And what about the job of this lady? I was thinking, I was consumed while reading the scenario and doing it, if there is any significance for her job. I don't think with epilepsy something with
yes.
modeling. Mm.
There is some important because these jobs people might drink
Mm.
too much, and there is a flash of light which might be a trigger of epilepsy sometimes.
Yeah, that's why I asked you about the mood while doing this job. This is only what come in my mind, and also illicit drugs, but I
Yes,
forget
illicit drug. You can
illicit
do it.
drugs and
You can do
alcohol.
it as enumeration,
Yeah.
Dr. Salma.
Mm.
If you want to
Also
say,
with injury.
Yeah, I did
yeah,
it. Yeah.
Also,
go ahead, Dr. Rajab.
also if there is a patient is doing some machinery job, he's working on the
Yeah,
machine, so it's
sharp.
also
Yeah, dealing with
not
sharps.
be.
Yes,
Mm.
but it will take. It's 10 minutes only. You cannot talk about all these things.
Yes, yes, yes.
Yeah, if you
He
want to explore,
is working model working for flashlights, stress for weight loss, and as
yeah,
a
Yeah.
model. We
what do you
should speak
think?
about
Yes, Yes. And what do you think she can proceed with her job? We didn't
She
talk
can
about it.
proceed. She can proceed, but just
How do you?
safety
Yeah.
netting. Just not drink alcohol too much, not use any illicit drugs, and not put
Okay.
herself in any stress. In order to protect herself in this
But I think
situation.
the light itself will provoke, and the
Yeah.
deprived sleep. She will work at night, and this is all will induce a seizure.
I believe
Yes, Dr. Aisha. Yeah.
Sleep deprivation also, you know.
I believe
But
this
Dr.
this
Aisha, in this scenario, if I touch this thing, it will consume the time,
yeah.
and
How
I
to
will not touch
convince her.
other
Yeah.
important things. Yeah.
How to convince her not to do the job.
Not to
I
convince,
believe.
just advise and refer.
Yeah.
As safety netting,
They will
yes. As
talk.
safety
Yes, they
netting.
will talk a lot about.
I believe we might include the occupational worker here because the job itself might hurt her, right? She might do this model shop or model fashion shop and show, and it might have the seizure, and maybe it will hurt herself. I don't know. I will ask now Dr. Arabia. She's
Mashallah,
a
what is the
neurologist.
risk, Doctor? No?
Yeah, if she's
Basim?
walking, for example, and she fell down, she hit her head, she might have something affecting her. So
No,
at least she has to be.
this common issue. And at any job, you can
Yes,
fall down and can develop the fit like that. But the job itself, there is a risk for his job,
no, no,
especially.
no. I am talking about possibility to restrict the job now or the occupation, or to reallocate her till the seizure will be controlled. Let's ask Dr. Rabia. She's a neurology consultant. If she is hearing us, Dr. Rabia, you are here. Wa alaikum assalam. We need your opinion now because this point I just thought about it. When
Tamam,
the
Dr. Basu, usually, if you're talking about the job, usually we
yeah,
have to restrict them for a period of 6 months, okay?
uh-huh.
Unless the seizures are controlled. Controlled seizures
Yes,
after that 6 months, okay? Not
okay,
example, for example, first seizure I have restricted, maybe she had a second seizure, okay? So once the seizures are controlled, from that time of period to the 6 months, she cannot work. For just like something like, for example, engineer or heavy machinery, or is she working in something like a swimmer or something? So you have to restrict the activities for a period of 6 months, okay?
okay. What about this job particularly as a model?
Modeling.
Yeah, is it
Modeling?
something to be
No,
restricted?
Sure. I mean to say modeling, if you mean to say that she has to go through the lights and something, usually these are
Yeah,
not the triggers. I'm sorry, any modeling is not a trigger. She can continue with the job, okay? But for
Yes, this
okay,
example,
is my
she's
opinion.
awaking late nights, you have to tell her about the triggers. I mean to say,
yeah,
she
yeah,
should maintain
Safety
a sleep
netting.
cycle. Yes,
Yes.
sleep cycle,
Yes.
cannot awake in the night continuously, okay? And she has to avoid a too much light, okay, on this
uh-huh,
age, okay? But if
yes,
she's controlled, I mean to say, if she's on
yeah,
medications, she can
mhm,
proceed with the job. Okay, there is no
okay,
problem in doing this job in modeling. Okay,
okay,
but you have to
okay,
safety net. I agree.
yeah, yeah, okay. At least she asked particularly and details what to do, doctor, in my job. We have to give her some warning about possibility to have the attacks during the show, and we have to warn her about, as you said, the triggers, how to avoid the
Yes,
triggers that can
true,
lead to these seizures.
Yeah,
Exactly.
true.
suppose we are speaking about the management plan. We will, we will involve a group of doctors and
Hmm.
including brain doctor,
Yes,
social worker, occupational health care worker.
yes,
She will advise later about
yes.
your job.
But
يعني أنا
yes, you're right.
لو
It's
أنا
not
عارف
our job,
الموديل،
Dr.
أنت
Ahmed.
عارف الموديل اللي بيعملوا إيه. I don't know what
You're
is
right. You're right.
the
But
original job of model. So I will involve the occupational health care
exactly, occupational,
worker.
they will. Yes. Okay, you are right and safe, by the way. But my point is, if the patient or the surrogate raised it to you, how to address it? Doctor, will I proceed with my job, or there is any problem, or there is any restriction? This is the
Mhm.
point. You might face this
That's
concern
the
in the
same
exam.
reply.
And in all scenario of
Yes,
seizure,
good.
Dr.
Yeah,
Bassem, as in all books of basis, they write the safety netting for seizures. You should talk about the hobbies and the job, and about
perfect.
being alone in one place,
Perfect.
like
Yes.
not to close the door like that, and
Perfect.
to
Yes.
also to offer another meeting with the one living with her.
Yes,
to learn
agree.
how to deal and how to manage or anything. And this is safety netting. So you will inform about these issues before leaving the meeting, because it is you
Yes,
are to be a safe doctor.
yes, exactly. I agree with you, Dr. Aisha.
Hi,
Yes, yes, Dr. Delli.
Assalamu alaikum.
Alaikum assalam.
Alaikum assalam. Thank you for the case, and Dr. Salma, she did well. But I want to just to be hard with the yeah my uh, with the small mistakes that it might turn the examiner or the surrogate off. So by the way, the surrogate was benign with her. Uh, for the introduction was great. Nothing to say. Was perfect introduction, and the conclusion is also great. So what the problem that in her performance, I guess that it's during the middle of things, not all of them, but she started to be uncertain, and she let the surrogate and the audience confused that we don't know, is it epilepsy? Sometimes she mentioned that epilepsy, and sometimes she said it's
Yeah, we
uncertain. We
connected this
need to
part.
do some
Yeah, we connected
investigation.
this part.
So I
Exactly.
agreed with Dr. Basim that just to arrange the thoughts for all of us, that from the start we need to say this is to breaking bad news, to have a golden silence. Sorry, I don't have good news for you today. And then what's wrong, doctor? What's wrong? And then the scenario. So as you mentioned, your investigation with me now, and that means that when you got the investigation, that's mean you have a disease called epilepsy, and this is this electrical. This is a long-term disease. So it needs we need to use a keyword so to understand what people usually want to know. Is it a temporal disease? Is it a curable disease? Is it a long life disease? And is it, so when you need to just explaining the disease to the patient, put this point in your mind, and then we wouldn't be lost during explanation of the disease. So this what that is, that it's the process of electrical activity in your brain. We don't know the cause, but there is known to have some triggers. So it's it depending. I mean that it's electrical activities in your brain causing this jerky movement in your legs and your hands. And by the way, the patient only know that he lost his consciousness and then find himself wet and with blood in his teeth, okay, in his mouth. So, and that could this process of electrical let you loss of your consciousness, and while you are losing your consciousness, you you will have a jerky movement. It witnessed from your doctor before, and that because he just might say, no, I don't have that. I only just lost my consciousness, and so and so. So just prepare yourself to be very accurate in your description of the disease in a professional way, that it's blah blah blah, this jerky movement associated with loss of consciousness and blah 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 blah. And the good thing that it would help a lot is that you could ask about the aura. Okay, why you could ask about the aura in this case? Because he's living alone, and
But it could
could
be history taking, Dr. Delli, right?
no no
So I
no
can enumerate it
yes,
as a,
no
as
at
a
all. I'm
manifestation.
100% sure. Okay, I'm 100% sure. This is not a history. It's
Uh-huh.
just when the patient said, yeah, just to put in points before we go. So if you explain that the disease, then you need to explain what the complication of this disease. So if you said, for example, this is a pathology, it's a electrical, and we don't know what exactly the cause, but usually we know some triggers about that. And what happen if the risk or complication of this is that you might, the most serious thing is you might injure yourself particularly your head. So that's why this kind of disease, it need to be controlled and need to be on regular follow-up. Okay. And just this, and then you could go for the social history for pregnancy, for hobbies, for something, and with whom do the patient live. And if the patient said, I'm living alone, just a question about, okay, if you are living alone and so on, just a question before the loss of consciousness, do you experience any abnormal feeling, abnormal sense of smell or something? If the patient said yes, because usually patient with epilepsy, they will offer to have what is called epilepsy alarm. There is alarm in his with bracelet in his neck, like something pendant alarm, or place it in his arm. So when he feel that, especially when he's living alone, just he feel that they press on that, and this will there is alarm center that way they just call him back, and then you will wait. They will wait. If he answered them, that is might sometimes might be by mistake, just press the alarm button. But if the patient didn't reply, usually there is district nurse or district, community nurse will come to his home, for example, to check if he's in home. So they will give yeah, just they could rescue him. Okay, or they will know that. So this is important. And sometimes they have alarm mats they could put, especially if the kind of epilepsy usually sometimes happen while he's in his bed sleeping. So this question sometimes is important for help. And the history question, usually if to offer help is acceptable, otherwise no. Not to diagnose, not to get the diagnosis or something, no, to offer help. For example, if the 2 or 3 occasions or 2 of them was in his bed, yeah, there is epilepsy mat in his bed, and sometimes there's alarm, and there is some other things that could offer to the patient if she knows that he's particularly living alone. Okay. And then
Dr. Dalia,
yes,
sorry
just
for
second.
interruption. If I don't know this sophisticated service, and I did like I did in the scenario, I asked her, is there anybody around you who you can trust and come with
I
you
believe
or
this is
go
fair
with
enough.
him?
Fair enough.
She told me that I have a friend. Sometimes I sleep with them. I stay with them. Then I told her that will be great, because in the first few months until your disease is controlled, you need to be with someone. You need not to be left alone. Is this will be enough
I,
as a safety
I would,
netting?
yeah,
Actually,
it would
thank
be
you for your
fair enough.
question.
I think,
Mhm.
Dr. Dalia, fair enough to mention these things. I think so. Okay, go ahead, Dr. Dalia.
Okay, thank you for this good question. By the way, you can't you could ask someone to be living with some, for example, if for young people, sometimes they choose to live in his own flat, after age of 18s. So you could ask him, it's better, yes, just give him an advice, then he could decide what he will do. Okay, is it she or he? So if she so if she said, I'm living alone, just advice for this kind of disease, it's need to be someone around you. How do you think about that? If said, no, I don't have family with me, and so at this time there is no other option for the patient. So what we need to know that advise the patient that to tell his family or his friend if they are living around. For example, if he don't want to live with any other person and could take care of himself and could, then you can't say to oblige him to do something he wouldn't want. Okay, so could say, I advise you to live with your family if that suits you. If that suits you, okay. And if you don't, I advise you to let your family and your friends know about your disease, that could
Yes.
just
Yeah,
check
this is
that with you. Sometimes they check that with phones and didn't reply, and just to know, just advise him to let your family and your friends and or your neighbors to know about your disease, so might rescue or might give you help. Okay,
yeah.
just
I think this is the point we should add to Dr. Salma suggestion. Let your friends and family knows about your condition in order to be aware and following you frequently. Yes.
yes,
Thank you for reminding about this point, Dr. Day. Yes.
yes,
Can you say
yeah.
anything?
Important, just important notice that please be aware not to be judgmental. For
Yes.
not say, for example, unfortunately, yeah. Try to avoid judgment about something. Yeah, that's and by the way, it's better to avoid to say, for example, it's good. It's good that it happened, or it's not good.
Yeah. Don't go details in
Yeah,
the
it's better
relationships.
to be on
I'm
safe
glad
side.
to think about returning back. Yeah, this is not our talk today. Yes.
Yes. Just put that explain the disease. If you have some physiology is needed to explain some symptoms or to explain, it will help you. Just mention some sort of physiology. But in this case, no need for physiology, just a pathology, just the symptoms. Okay, the electrical activity leads to this loss of consciousness you have, and explain that. And then the complication, that the complication, there is risk with the complication of injury your head and injury. That's why we need someone just to give him the safety netting. And by the way, ask the patient if he's just to make sure his bed is, there is sometimes bedside locker or bedside table beside
I,
the bed.
I don't think Dr. Dalia will go deep to these details and
I
about
mean,
the rails and
yeah, I mean, we can't go deeply on that,
yeah, no
but
need, no need.
but
It's 10
yeah,
minutes.
but I mean that when you know something in your mind, and if your time is, you have a time at the end, sometimes you could sit like that, and you don't have something to say. And surrogate was you've done very well from the start, and you have time. So what kind of thing you could fill your time with? That you could fill your time with safety netting.
Safety net, yes.
Okay, so
Mhm.
safety netting, just put in your mind, if particularly the bed, if no pointing, you could be if it's padded bed, it's good. And if you to put away the bedside table or locker, make the atmosphere is safer, particularly in the bed, particularly in the that. For example, if he has upper room and downstairs room, it's better to avoid the stairs. Okay, and kind of thing. Just think about things together, and the hobbies and everything you've mentioned was great. And for pregnancy and hobbies, and just one thing for safety netting was most important, that high altitude.
Yeah, to be avoided.
Yes.
Exactly.
So because yeah, they usually go for climbing something, and just let them.
It will be added to the hobbies, Dr. Dalia, I guess.
Yes, yes.
It will be
Just give him
added to the hobbies.
avoid
Yeah.
high altitude, avoid swimming in your own.
Yes.
And for
And
the
locking the
driving,
door.
yes, yeah. If he said no, I can't stop swimming. Okay, said not to stop swim is my
Have a
advice is
company.
to be
Yeah.
accompanied by someone while you
Yes,
are
exactly.
swimming. The second thing regarding the driving license, the driving license, it could be if he asks you, that's mean I couldn't drive anymore. So you could say it depends on your clinical, in your condition. Sometimes people they could regain if they are well controlled for a long time, that it will be
Yeah,
that
it will be
will,
according to the rules.
will assist
There is,
you.
yeah, there is
And you need,
guidelines for that.
yes, and you need to see some where they be liked by the examiner. If they said no, I wouldn't want to stop my driving. What the usually the examiner waiting for to from you is to say, to be not confrontational with the patient. Okay, so this is the art of the here of communication. It to be yes,
To be sorry and advice at the same time.
but we are obliged legally. This is legal things. Is they want to listen to legal, so said it's legal obligation. Okay, by the DVLA. Legal, they mean that they will go to the court, and we don't need to express more. Just legal, it's fair enough. If you said legal, we apply. We are legally obliged. Okay, for that to stop driving, and we'll put you on regular follow-up and under assessment. And if your disease is controlled with medication for longer time, this will be assessed by the DVLA later on. Okay, and they might let you regain your
Driving back.
license later on.
Yeah.
Okay, just thank you. Sorry for.
Thank you, Dr. Dalia.
Thank you, Dr. Dalia. Thank you. Thank you for the hardness.
No worries, we are learning from
appreciated.
all this.
So much appreciated.
سؤال بسيط لدكتورة داليا بس.
Okay.
If the
No,
patient
please,
candidate.
Dr. Rashid. Okay, let's read the scenario for Dr. Ibrahim. Then
خلاص.
you can ask the question. Sorry,
Okay.
just a couple of minutes. Dr. Ibrahim, your scenario, Mr. Yusuf, 51 years. You are the doctor in the intensive care unit discussing complication of bacterial meningitis. Mr. Yusuf, 51 years old, and you are talking to Mrs. Najla Yusuf, the patient wife. Okay, the patient are admitted 1 week ago with decreased level of consciousness, fever, and neck stiffness. He was intubated and shifted to ICU. He had a lumbar puncture that confirmed pneumococcal meningitis. He has well-controlled diabetes, works as a builder, and has 2 kids. He is currently trained from ventilator via tracheostomy, but still confused and left side weakness as a residual. He has nasogastric tube for feeding and urinary catheter. The patient wife is upset about her husband's condition. Please, your task to explain his current condition and uncertainty of his future prognosis. I will give you 1 minute, Dr. Ibrahim, then we can start the scenario, okay? Now,
Okay.
Dr. Rashid, you can ask your question. Sorry for interrupting you. Dr. Rashid?
Yes.
Yeah, go ahead,
My
please.
question for Dr. Dalia, if the patient, if you reach to a point that the patient is candidate for this alarming system or service, my question, how we will get the access for that? If you can offer the patient direct كده ولا through social worker?
Yeah, you can offer. Sorry, Dr. Dalia, but I know this information. If the patient is living alone and no one can stay with him, this is the time to offer this system, which is red button alarm system. Isn't Dr. Dalia?
What is the access for this? How will get the service?
Okay, because this good question, by the way, but you don't need to know that. Just offer, okay? Just offer it.
But
because
offer it,
here
he
in
will
UK
ask-
there is many trust in UK and many there are different system. So sometimes it could be offered by the community, sometimes it could be, and there is important thing that it's usually be in scenario that's what's the role of your role. Are you in the neurology clinic? Okay, it's different to be from out general medicine out clinic or acute medicine,
Yeah.
so if it's that, they will just let them know you don't need to know what exactly the access for that because different. You got me?
Okay.
Just offer. Yeah, we will provide you, our team will provide you with the alarm that help you in your home or something like that. Just set the safety
As a
net
solution كده.
triggers. Just avoid sleeping late at night, avoid flashes and TV, cinema.
I have a
Yes.
question about
Okay, شكرا.
alarming.
Thank you so much.
About alarming this system, you will explain to the patient the prodromal before prodromal signs before epilepsy starting?
Y-
Irritability, anxiety,
Yes.
The 10 minutes will not allow all this question.
ما
I
هو
don't think.
the
Yeah,
10
but
minutes
it's
and the
okay.
brain also will not remember
No,
all
no,
of
no. I
this.
don't think they have this details instruction as a surrogate. Anyway, let's hear Dr. Daria and we'll proceed with Dr.
But not
Ibrahim
all
for
the
the next
patient has
scenario.
prodroma, and even this prodroma within second. So what he can do if he has prodroma?
That's why
I
it's pendant or wearing like a bracelet in his hand. It take only 1
think
second.
no need for this prodroma because it's
Okay.
no action she will take, or it's not on all patients. It is and different prodroma. Maybe one bad smell, maybe one hallucination or
Yeah, not all patients having the
sensation.
aura. Yes, exactly. So I don't put
It's
yourself in trouble
helpful.
with this.
I mean that it would be helpful if the patient has aura, it could have some help. If the patient has no aura, that's no, we
Yeah.
can't. Yeah. Also, you could put the alarm because he might feel confused after that. He might be injured and can't stand up after the seizures. Okay. For example, let's say he has a seizures. He just fell from the stairs and now can't walk and need help. What shall he do? Okay, that's why they provide them with the alarm. Okay, and bracelet that is epilepsy patient, and that alarm, even it took 1 second to press it.
Yes, and the ambulance directly will direct
Yes,
to the
yeah,
area of this testing. Yes.
yes.
Okay, thank you, Dr. Dalia. I guess Dr. Ibrahim is ready now. We can start, Dr. Ibrahim.
Yes, we can
Dr.
start.
Salma as a surrogate. Yes, please. Here you go.
Hi,
Hi.
may I confirm I'm speaking to Mrs. Najla?
Yes, I am.
You are wife of Mr. Yusuf, was admitted in our ICU.
Yes, my husband is Yusuf.
May I confirm that you are the next of kin of your husband,
Yes, I'm his wife.
and he didn't name anyone to take decision in behalf of him?
No,
He didn't.
no, he
Okay.
didn't.
Okay. Do you want anyone to attend this meeting with us today as we are talking about your husband's condition?
No.
Okay, Mrs. Najla, can you tell me how much do you know about your husband's problem?
Yes, a week ago, my husband suddenly lost his conscious, and he was having some high temperature, and they took him to this hospital, and they told us that he is having some condition, I can't remember actually, affecting his brain, and he is with you. So I came here today to know about his condition. How is he now? Is he improving? Can you please tell me about his condition?
Okay, Mrs. Najla, I'm sorry to tell you that we reached the diagnosis of your husband, and it's not as we thought.
What do you mean?
And we found the disease called meningitis. Do you know this
What is
disease?
that? No, I don't know.
Do you want me to explain more about this?
Yes, please, doctor.
It's germ that attacks the layers covering of the brain in the head, and this germ is transmitted from person to person. We call it infectious, can be transmitted by droplet from person to person. And this germ attacks the brain and cause damage unless it is treated early. And unfortunately, your husband reach the hospital with advanced disease and loss of conscious. And this germ might cause loss of conscious, might cause fever and vomiting. It might cause skin rash and might transmit it to those people in the work or in the home. That's why we also always offer protection for people with him in the home, and also might be in the work office or something like this. It might lead this disease might lead to complication, might be long-term complication, and most of the times might be treated when the patient receive the treatment for this germ, meningococcal. We called it meningococcal. He might get rid of any complication. And about your husband, today we reached the diagnosis and we are starting the treatment now. But we are not sure about his. He had some improvement, but we are not sure about his, what's the residual of this disease for him, as he is now still having depending on machines and he's still confused. Can you tell me, Miss Najla, who is depending on your husband in home?
Me and my kids. But doctor, please tell me, is my husband going to die or is he improving? I didn't understand much from what you are discussing.
Okay, I'm sorry, Miss Najla, about Mrs. Najla, about this bad news today, and I appreciate your feeling. I assure you that we are started the treatment and he shows some improvements, but we are not sure about the future prognosis, but what we are sure about it, that is he is starting a treatment and we are getting rid of this germ, and I don't know, there is no possibility he will die from this disease, but we are not sure about his long-term functional abilities. Okay.
Okay. So you said that there is some treatment for us and me and my kids, so to prevent this. So my kids now can go to school or no?
Let me tell you that they should be screened for I'm sorry, they should receive the protection. It's a single pill, and after that they can go to their school. No problem about this. If they didn't show any signs or
كويسين خالص والله.
any symptoms of the disease. Okay. But
Okay. So can I see my husband?
once we are now started the treatment and he is on the treatment, yes, your husband, you can see him, but you also you should wear a mask. Still, you should wear mask and protective measures. But you can see him, yes.
Okay.
And let me ask about what are you financially supported? Are you need me to arrange any social worker to help you?
Thank you for asking, doctor. Yes, my husband is self-employed, so we depend on his daily income. That's why we don't know how to do now. It's very frustrating for us.
Okay, we will arrange social worker to be in contact with you to arrange help for you about this, you and your kids. I'm really sorry about this bad news today, but I want to ask you, have you any, do you have any more concern about your husband's condition?
2 minutes.
No, no, thank you, doctor.
Okay, Ms. Saran, to brief that you, I told you about your husband's condition, and it can be transmitted, and it attacks the brain layers and might cause some damage. It's a treatable disease, but if some damage can still for a long time. Are you are you going with me now?
Yes, you said that my husband can have some residual damage for a long time. So that means he might be in a wheelchair?
Yes, yeah, he might be in the wheelchair, but we are not sure about the prognosis. He might show a good recovery, but he's still in the treatment.
Hmm.
And
Okay.
Ms. Sarah, I will give you leaflets and brochures and websites to read more about this disease and how to deal with patient. And also, if you have any concern or any query about your husband's condition, I will give you our contact number of this department. Don't hesitate to call us.
Thank you,
Okay.
doctor. Thank you.
Okay, time is up. Well done, Dr. Ibrahim, as first practice with us, right? It's great, and we can hear Dr. Salma comment, then I will comment.
Okay, make the introduction fixed for you. So, firstly, you didn't take permission. You have to take permission from the surrogate.
No, he's
We are
drowsy.
we
The patient,
what?
you mean?
No, you are talking to the wife. So we are here today to discuss some issues about the health status of your husband. Is this okay with you? This is a permission to talk. Okay. I don't know if you introduce yourself. You said that I am Dr. Fulan.
No, he
The
didn't
doctor.
introduce at all. No, he
Yeah, you
didn't.
should introduce yourself. I am Dr. Family name. The doctor in the intensive unit or in the clinic today. But it is written, I think, intensive unit. So
Yeah,
intensive
critical
unit.
care.
Yeah, this is
All right,
number one. You just, I will just,
no need to
because it is,
mention what's the name.
I am new in this also, so I will put it in like pieces. Number one, introduce yourself. This is, I think, mandatory in the introduction. Number two, take permission from the surrogate. Is this okay with you to discuss some issues about the health status of you or of your husband, of your anything? The permission. Next of kin. I'm not sure yet, but everybody here said that if still the wife, you still have to ask her if she's the next of kin. Three things. Then you enter the scenario. When you enter the scenario, you mentioned that she mentioned for you that my husband lost consciousness, and they told us that there is a condition in his brain, and he's here in the intensive unit with you. You used ICU, short for intensive care. I don't know if this is jargon. You should say first intensive unit. Let us call it ICU, and then use ICU for the rest of your scenario. Because you might think that ICU is in another place. you shifted her husband to another place. I don't know, correct me if I am wrong. Number 4, you explain the disease. That is good, because you don't know anything about the meningitis. But your task is to explain the complication immediately, and I think this is uncertain prognosis or outcome. So you should explain that your husband is having complication of this disease. Yes, he's weaning from the ventilator, and he did not also explain about ventilator. He was not breathing by himself. That's why we put for him this ventilator to help him breathe. And yes, he's weaning now from the ventilator, but still he is confused. So he did not regain his level of consciousness fully. And he still have a weakness in his left side, and we feed him through a tube through his nose, and we are putting for him a catheter. Prepare her to see these things, not to ask again about them. Why this catheter? Why this? When she will see her husband. And then when she is asked you in the end, will he be in a wheelchair? I think your answer should be vice versa. Not yes, he will be in wheelchair, but we don't know yet about his condition. No, first you say we are uncertain about his
I think I said
condition.
might.
Yeah, and
Because
yeah, might be, yes.
in the scenario, we are not sure about.
We are not sure. That's right. That's right. He might be completely improved, or he might have some bad outcome from this condition. We still not certain about that, but don't worry. He's under our care, and we are taking good care of him. A group of specialists are taking care of him like this. About the contact, she asked you, you answer. She didn't ask you, you didn't mention. I believe like that. I don't know. What do you think, Dr. Basim? Because
Yes,
we have different, yeah. And he also gives one information not written in the scenario, that your husband got a rash. I think this is not Neisseria meningitis, so rash is not mentioned.
No, I didn't said that your husband got rash in the
no, I
in
didn't hear rash. Yeah.
documentation. Usually, you should explain when you are explaining the disease. You can explain the symptoms might happen, like vomiting. I know there is no vomiting in the scenario, but I should explain the symptoms might happen, because I'm talking to also about the infectious disease. It might you might see anything on your kids. Okay, I said fever. I
So,
said
yeah,
vomiting. I said rash. As a complication might happen, or symptoms might happen during the disease. Not that your husband had these things. Yeah.
Okay,
yeah, as
fair
a
enough,
learning.
fair enough.
Yes.
But if I am in your place, I will just explain the symptoms explained in the scenario. Your husband is experiencing high-grade fever, neck stiffness, and loss of consciousness. And these are the manifestations of this condition. And he admitted with us here in the intensive care unit, and blah, blah, the other scenario. So about the contact, what do you think, Dr. Basim? If she asked, wait for her to ask,
No, we have
because
to do
not
contact tracing.
not all series of meningitis, they have vaccine. It is written in pneumococcal meningitis clearly, yes.
So meningococcal need to be, yes, clearly.
Pneumococcal,
Yes,
pneumococcal,
meningococcal, which is meningococcal, need to be
yes, need
contact
to be,
traced.
yes,
Yes,
contact
exactly.
trace.
The
So he should
doesn't need.
mention.
Yes, he should. He should by himself. Not waiting
Okay.
for you.
Okay. And also, yesterday, Dr. Ahmad, he said, don't say we will give the vaccine. You say that we will refer you to a department called Infectious Control Department,
Exactly.
which is the department who's caring about investigating and
Tracing.
tracing, yes, tracing, and deciding to give the suitable treatment for the contact.
Exactly.
That's it.
Perfect, Dr. Salma. Really, I guess this is neurology day. So epilepsy and meningitis meningitis. Very nice
Yes.
topic, and both of them are high yield in the exam. I like the scenario, of course, because it comes late in the last diet, I guess, and it's frequently repeated from center to center. I will try to comment and to fix the points for Dr. Ibrahim and for all of us. The introduction, Dr. Ibrahim, before confirming the patient name, introduce yourself. I am Dr. X, one of the doctors here. This is the most simple way to explain, introduce yourself. I am Dr. Ibrahim, one of the doctors here. That's it. Then confirm the patient name. You are Mrs. and you are the one. Uh, you are the Mrs. For example, Z. I assume you are the next of kin, and I assume we got permission from your husband. However, the husband now is already confused, so I don't think there is permission here. So I don't think you can say there is permission, or we assume we have permission. Why? Because he's confused. So how to deal with this? I assume you are the next of kin for Mr. X, and here in this scenario, I believe as you did, you can invite someone. Why? Because the patient already lost the capacity. Someone will argue, yes, why will invite? This is breaking confidentiality. But again, as I'm always saying, once the patient lost the capacity, means he's not anymore having confidentiality. And this patient already confused. So you can invite someone just to support her wife. Okay, maybe the sons or any her sister or whosoever. Let's go to the next step. The confirmation, the introduction finished. Then what is that the scenario is? This is breaking bad news. Do you think this is good news or this is simple news, Dr. Ibrahim? Patient already had meningitis and the outcome is poor. He's confused. After he was builder and he's the one supporting the home, now he's on the bed. This is breaking bad news scenario. So I would start with breaking bad news by golden silence and warning shots as we do usually. Then explain the disease, or you can tell her, do you know anything about your husband? Yes, I know he has
I
one
think
problem.
I explained bad news. I think I went
Yeah, you
silent.
accept. I prefer to do it in our way. Do you follow me? Of course, you have to confirm the follow after background. What's your background about your husband condition and what's your expectation? I'm here to give you some news, and I'm sorry, it's not good news as we hope. In this way, exactly. Or we have concerned news
But
because you are.
let me ask you a question.
Yes,
I told her, are you want anyone there to attend
yes, I
this
agree for that. I
meeting?
agree. Yes, I agree with you.
Let me finish. As we
Uh-huh.
are talking about your husband's condition,
Yes.
can this be as a taking consent to talk about?
Good point to mention. Yes, it's okay. But
Because I said, are you
yes,
want anyone to attend this meeting
someone to
as
attend the
we are
meeting.
going to talk about your husband's condition?
Perfect. Yes, perfect to do so. No problem. But I'm talking about the breaking bad news now.
Yes.
You didn't do it in the way you are preferring to do. Okay, I know
I
everyone
said
has his
it's not
approach.
as we hope, and I stayed silent for
You did?
why?
Okay. So
Yes,
you will say after that,
he
perfect.
break bad news,
I'm
Dr.
so sorry.
Bassem.
Maybe I didn't hear it in details. Good.
Dr. Bassem,
Yes.
he break the bad news.
Okay,
That's
good.
why I didn't comment on that. But
Perfect.
he's asking about taking permission. Is this count for him that he took permission
Yes,
when he
yes,
make
this
it
is my
together
question.
in one sentence? I believe that in basis they want to hear the permission from the first second of the yes, I am new in commenting, but I know
Uh-huh.
this for sure. They wanted to hear you take permission from the start. What do you
This is
think?
what you
Yeah.
are saying. I assume you are the next of kin, and
Uh-huh.
here no consent or permission from for the husband from the husband. Why? Because he's already confused. How you can
I see.
assume we got the permission and he's confused?
No, not permission from the husband. You did not understand.
From permission to
For
attend
the
another.
whole scenario, for the whole setting, for the whole
of
discussion.
course. We are here to discuss
Yeah.
about your husband issue. Of course, this is definitely.
Are you okay with that? Like this, they want to hear this sentence, I think. Yeah.
This is after introduce yourself, of course, and confirming her and her husband information. Okay. Let's go to the meningococcal. You didn't mention the diagnosis, Dr. Ibrahim, as your husband is having meningococcal meningitis. Have you ever heard about this?
I am sorry for
you explained. Yes, I know you explained. Yeah, you explained, but I prefer to do it earlier. I mean the opposite. Don't explain, then tell her. The opposite. Tell her the condition, then explain it. Have you ever heard about this? Is the way, by the way, everyone, every mentor doing that. Have you ever heard about meningococcal meningitis or meningitis? If you don't want, but I prefer to do it in once. Meningococcal meningitis. No, doctor, I never. You want me to explain? Yes, doctor, please. I want to know what happened and proceed. The first thing to a counsel about the disease, explain the disease and the pathology. What happened? As you said, germ or bug infected your husband layers of the brain, and you can draw, of course. Someone like to draw, so draw. And he's now having the complication of this condition. You explain the pathology, then the complication. If you want to say the manifestation earlier, I don't think, because he already now presented, he's already now in complication of meningitis. So why I will say he came with fever? I know, and she knows that he came with fever and neck stiffness. I don't prefer to do something which is already written. Now you are counseling about meningitis, so you will explain the pathology, bug, finished. Then now the manifestation. He is in coma, and this is one of the complications. So the complication or manifestation as a current condition. And if you want to go further, and some patient might lose their life because of this disease, because the outcome you don't know. Yes, there is some improvement, but also it might happen as a sequel of the disease. Okay, let's go to the next. And your husband underwent a lot of procedure. One of them, tracheostomy. You can explain the tracheostomy simply, quickly. It's a hole in his windpipe to breathe through it. And the other thing, a pipe also through the gut to get his feeding. This is what's written in the scenario. They want you to do what's written in the scenario. As Dr. Salma said, you didn't explain or you didn't mention anything about the tracheostomy. You just read it and nothing else. And the NGT, nothing. And the current condition, which is, she asked you what will happen with him. Yeah, there is a possibility to be disabled. Now he has confusion. He's not aware about us. He is having weakness in one side of his body. I'm so sorry to give you all this information. I know, and blah, blah. And always keep asking for understanding. Are you following me? Are you understanding me? I want to make it as a scheme for all. Then wait for her concern. What she will ask, if she has any concern related to the disease, do you want me to explain more? No, thank you. Anything you have any concern? No, doctor. Now your role is to explain about the contact tracing, as you did exactly. We want to do 1, 2, 3. We inform our office called infection control team. They are the one responsible for.
By the way,
yes.
I am sorry. I thought
no. Go ahead.
In meningitis, but in pneumococcal usually doesn't need contact tracing and doesn't need protection.
No, it needs. The meningococcal, it needs. The Neisseria, it doesn't need. You mix. The meningococcal need, and you can give the prophylaxis.
That's why Dr. Basim, Dr. Ahmed yesterday, he told just refer to the infectious control. Because maybe you are not sure. Maybe you are not sure. Maybe you are not sure about what they will do. If it need, maybe you forget if pneumococcal need tracing or not. If anything could happen to you at that time in the stress of the exam. So you just tell her that we are going to refer you and your kids to a department here, which is infection control department. It's the department which concern about the contact tracing.
Okay.
They are going to evaluate you and give you the proper treatment. That's
perfect. This is related.
Yeah.
What's my job? But I'm talking about the point itself. need or no? Dr. Dalia wrote no. What do you mean by no, Dr. Dalia? About what? To inform
Yeah.
the infection control?
Yeah, you just said that the reverse. So for Neisseria meningitis, or it's needs to
Pneumococcal.
contact tracing. It needs to treat with the contact with antibiotic. And for pneumococcal, no. Usually no need for contact tracing and not contagious.
Pneumococcal no need, opposite, you mean? Okay, I mix. Okay,
Yes,
I
yes.
make it up.
Pneumococcal
Okay.
need. Yes.
Yes, yes, okay.
Unlikely.
And
Sometimes when it comes like isolated cases, usually, unless there's something, there is no something fixed in medicine, but this is the mostly no need for treatment.
okay, and the prophylaxis for
No need.
meningococcal.
No need. Okay,
I
so
just read it in
what?
Past Medicine. No need for what?
Yeah.
Even prophylaxis?
Prophylaxis, just vaccination during childhood, or they like booster dose if the
No.
patient's like immunosuppressed or something. I mean it's general measures. If the children is not
I read it
vaccinated
in
or
the Past Medicine. No. After contact tracing, there is some contacts with the patients, and we have to trace them. We're gonna give them medication, rifampicin and cephalosporin. This is what I read it recently.
yeah,
Right?
Meningococcal, isn't it?
Yeah,
this is
meningococcal. I'm saying meningococcal. Yes.
Yes.
this is that's as far as I know, that need tracing and antibiotic treatment for the contact. It's for Neisseria.
Okay,
meningitis,
contact
not
tracing for Neisseria. Now
pneumococcal.
I'm talking the prophylaxis meningococcal. So everyone has its specific character. So the meningococcal need to be vaccinated and given medication, and the Neisseria need to be traced, right?
No, I think the same
Oh,
meningococcal and
yeah.
Neisseria meningitis.
Neisseria is the
Both of
most
them.
dangerous and most contagious one. Neisseria.
Okay, we'll review it today because I
Yeah.
was.
Yeah,
I'm
he
writing
managed
from
meningococcal ما same Neisseria meningitis.
No.
أنا
Pneumococcal.
All of us mixed now.
Dr.
No.
Dr. Basim.
Neisseria meningitis.
Yeah.
Sorry,
Yes.
according to
Go ahead.
what I write from Dr. Hussam,
Yeah.
he said
Yeah.
about meningococcal meningitis that it's need isolation, notification, and contact tracing for the meningococcal meningitis.
Thank you.
Okay,
Thank you, Dr.
Neisseria
Samia.
one.
So, okay,
but
go ahead.
for
But
pneumococcal, he said no need for isolation.
Dr. Samia, you again mentioned the same meningococcal. It's the same pneumococcal.
No.
No, different.
meningococcal same Neisseria meningitis.
Meningococcal, yeah, it's Neisseria meningitis.
Yes,
So we said
أيوة.
meningococcal meningitis.
Yes, that is Neisseria meningitis.
This is Neisseria meningitis.
Yes.
And
And
this
this
is
is the
اللي هو
زي
القزم بتاع الجونورية أخو الجونورية.
أيوة.
Yes.
okay. Neisseria is pneumococcal.
meningococcal.
No. This is
Meningococcal.
No,
Neisseria meningitis is meningococcal meningitis.
أيوة
Yes.
بالضبط.
Okay.
Yes.
And the other one, pneumococcal,
Pneumococcal is, yeah.
is streptococcal.
Our
This
case
is,
now.
Yeah.
yeah,
This is our
streptococcal.
case. Yeah,
Okay.
streptococcal, yes.
So because I mix the name, I make everything drama.
Yes, I know.
Okay.
For contact, so he asked for contact. He can get it. Her husband.
Let's summarize. Yes, let's summarize. Right, Dr. Rashid. So for the meningococcal, which is Neisseria, need
Yes.
to be
Yes.
isolated, contact
Yes.
traced.
Neisseria is identifiable disease
Yes.
like
Yes,
TB.
yes, that's what I mentioned.
Then we
Neisseria,
notify the infection control team to contact the relative and the team
Yes.
teammates in the work. This
Exactly.
is Neisseria
Yes.
meningococci is the same. Pneumococci
Yes.
is a strip. Pneumococci is a less severe one.
exactly.
But
Yes.
the point here, if it is less severe one, it is permitted for her to visit him in the ICU. Dr. Salma didn't mention about this point.
No.
The surrogate.
Yeah.
No
Does
need
he
to
permit it?
isolation in pneumococcal. No need for
Any
isolation.
meningitis need to be isolated for 48 hours after starting medication.
For
After that,
pneumococcal, I think for pneumococcal, no need.
For
No, he
Just
can
pneumococcal,
visit.
no need.
He can visit, but only with
I
the
already sent for
contact
you
precaution
the
only.
guideline, okay? It's
really?
in the
Okay.
group.
Okay.
I think he can visit for pneumococcal with contact precaution only. Not like meningococcus. That could need what we call it, mask 50 like that,
Yeah, 95.
gown
Yes.
like that.
Yeah. Because it's more serious and contagious. Yes.
Yes.
Okay. So the sum up, Neisseria is the meningococcal, which I am talking about.
But
Both
I
of
have
them.
another question. In this scenario, we can raise a concern about a lost power of attorney or advanced directive, as Dr. Ibrahim mentioned it in the with the start of his.
Yeah. From the start, no need, Dr. Ibrahim. Yes, this is a good question. Thank you. No need to mention it. Why you ask this question early? If you want, maybe late, but even late, you don't know what will happen with the patient. He's improving and he's regaining his conscious level. But if they said for you his outcome is poor, I believe you can raise it. Anyone take decision on behalf of him or nominate anyone to take decision on behalf of him. But not
I
at the
think
beginning.
when the patient is unconscious, the one who you should talk to him is next of kin or the one who has a power of attorney, I think.
I think it's too deep to expect if he wrote how he knows that he will be in meningitis in the coming days. He's young. You got it? No one will expect, and no, you cannot pretend that. You got it?
Mhm.
Make it simple.
And it
Don't
is
make
acute
it
issue
complicated.
also, يعني. That's a problem.
Don't make it complicated. Make it as simple as you can.
Mhm.
Okay. Sorry guys if I confuse you because I am the one confused again to mention both organism as different meningitis, but both of them was the same meningitis. And again, both of them, as already know, need to be contact tracing, the meningococcal and Neisseria, which is the same, different than the pneumococcal, which I thought it's another one, and now it's another, say, infection or species. I hope it's clear now after this confusion.
So
Maybe this
if they
confusion.
mentioned in the scenario it's Neisseria meningitis, we should tell the patient immediately
Yes.
that we
Yeah,
need
this
to
is
trace
contact
and like this
tracing.
volunteer
Yes.
telling this information.
It's not volunteer, we have to.
Yeah. I mean, we have to tell
Yes,
before
volunteer
she's
from our
asking.
side. Yeah, not
But
volunteer from the
but
target.
in
The
case
wife
of
asked if the
pneumococcal,
fault.
I have very important to
يعني
tell the patient.
Yes, we have to.
So
We have to. Yeah,
yeah,
that's
I
why
know
we are
very
saying we have to.
contagious and very
Exactly.
infectious. So
Yes.
she will take care
Yes,
not
we
to
have.
visit to come near to the patient like that.
Yes, exactly. Yes, I believe yes. Yeah, go ahead, Dr. Selma. Yes, what else you want to do?
no, you answer my question. So if it is Neisseria, we should mention that. We need
Yes.
to refer you to the infectious control for this by ourselves. But because
Exactly.
it's pneumococcal, we should wait for the patient to ask. Right?
Exactly. Yes. Pneumococcal.
Mm.
Even if she asks, no need at all. Even if she asks, and no need to mention it. Neisseria only the notifiable one, which is the same meningococcal, which I was thinking it's different. No, they are the same. Meningococcal, they are the same as Neisseria meningitis. Sorry again for this mistake. I hope maybe this debate make this meningitis clear now for all of us because also the name is similar to each other, pneumococcal and meningococcal, and it will be more clear and I hope no one will mix it again like what I did. Hopefully, is it clear, all of you?
Yes.
Okay. Any comment or question from Dr. Salma and Dr. Ibrahim? By the way, Dr. Ibrahim, as the first time practice, it's great just to make it organized a little bit. So explain the disease first, then the manifestation, then the complication, not the opposite. So no need to say the manifestation before the explanation. I prefer these steps. If anyone has his approach do good your approach, but I want to make it fixed for all scenarios. Any counsel about the disease, do in this way: pathology or the cause or the underlying cause, then the manifestation, then the complication. Even you can explain if there is serious complication. You have to tell about the serious complication, because you might face the serious complication in the scenario. I like this scenario. Patient already confused, so you can face the confusion, and she will tell you, no, doctor, I expect he will come back, he will be recovered. No, don't give false hope. In this
Assalamu
patient,
alaikum.
alaikum salam wa barakatuh.
I didn't see at first this is pneumococcal, but the most common complication of pneumococcal meningitis, as I read, it's the deafness, loss of hearing, about 50%, I think.
Yeah. Pneumococcal.
Pneumococcal meningitis, yeah.
Okay. Thank you, Dr. Ibrahim, for clarifying. So in this scenario, again, we will not notify because it's pneumococcal, right? So we did
Yes.
All as a mistake. No need for notification, because again, I think also some doctors were confused like me while we are talking about pneumococcal as meningococcal. In this scenario, no need at all for contact tracing as a pneumococcal. Okay, clear?
هو الدكتور عماد امبارح yesterday told you can run away from the answer of this question, inform the wife.
Exactly. Yes,
exactly. Control team. Cut it short.
Exactly. This is good answer.
Will our ICM nurse will sit with you and give you the details about the risk of exposure, the complication of exposure, if you don't know.
Okay, now you know. After this conflict.
Dr. Basim, I keep telling you this since the beginning.
I am talking
about telling you.
meningococcal as Neisseria, and the opposite, Neisseria as meningococcal. And it was different, or both of them are the same.
Yeah.
Sorry, Dr. Salma, I'm so sorry.
And Dr. Imad yesterday, he told to run away from this, like this doctor said. Even if it is, this or this, you just say that we will refer you. And this is actually what will happen. You are not going to deal with this by yourself. Even if you break this thing as a part of the management, you will tell that an infectious control team will take care of the contact tracing. Just
perfect. Perfect.
By
Thank
the
you,
way,
Dr. Salma. Yes,
by the
Dr.
way,
Ben.
meningitis is my case, communication case in my exam. So
really?
Yes. But the Neisseria one. Okay.
Okay. So
Okay.
the different one, yeah. Okay.
Yeah, the different one. So in general, she just the surrogate asked about what I am not expected that I didn't need to, to be empathy and sympathy. She just worried about herself and her kids. She
Oh my
didn't
God.
care about her husband.
This
Okay.
is funny.
Her
Very
own
funny.
concerns about herself and her kids. So she's really worried about herself and her kids. So just all question around this area, and just said what we're gonna have, what our risk, and what our do our kids want to go to school or no, for how many days, and so on.
Perfect.
Okay.
Yeah.
So just I said, I just replied to her for kids. Yeah, it's a really dangerous disease and contagious. Okay, so we need to. It's a notifiable disease that we need to notify that, and they will contact you. They definitely will contact you. Okay, that's usually what happened. They will contact you, and we need to follow their instructions. Okay. Okay, because this is a really serious disease, and your kids keep your kids at home. Okay, and they will give you the full instruction about that. Okay, usually he asked me, we will gonna have treatment like that. Yes, most probably you will have a treatment, prophylaxis treatment, but you need to, yes, I gave you want to know, just keep digging on my knowledge. So
Mhm.
don't expect always that. If you said, okay, you will contact them, they will contact you. Usually they will contact her number and they know her number
Yes,
and just give
exactly.
her the instruction. But sometimes she just still just is worrying about herself and ask, could I have treatment for that? And no, like that. Okay. I
Mhm.
said usually for Neisseria meningitis, usually they give the contact antibiotic. So
Yes.
just wait for the contact from the the infectious control. Okay. And just
Mhm.
the kids not need to go to school. And just I'm not sure, but it was 2 weeks not to go to school for about 2 weeks, but I'm not sure. So I said that it's usually it's around, but we need to follow. It's around 2 weeks,
Yeah.
but we need to follow the infectious controls in instructions. Okay, so don't worry, they will give you the full instruction, the full things, and so on. So just for Dr. Ibrahim, yeah.
Mhm.
In this scenario, they need to know. Please don't give the surrogate false hope. This is the most important
Yes,
because this
exactly.
is uncertain and give the all complication that might happen. So just to not say no, she absolutely not die. He said something like that. He wouldn't die.
Yes.
That's
Yeah, yeah,
this is a
yeah.
Yeah,
big no.
yeah.
Nothing absolute. Okay, nothing
Let me
absolute.
say the pneumococcal meningitis is usually a curable disease. It's not
Yeah,
curable.
suppose,
And
No,
suppose, yeah.
no.
once you started treatment, it's
Early.
no possibility, as I
Yeah,
said,
yeah,
no
early.
possibility to die
It's
because
not about the disease itself alone, Dr. Ibrahim.
Maybe
There is
immunocompromised one.
other circumstances like
Yes,
hospital
exactly.
things, like even medical error. Anything could happen.
By
Comorbidity,
the
So,
way,
medical
yeah,
comorbidity.
so don't say
Yeah,
by the
comorbidities.
way,
Yes.
for pneumococcal meningitis, around 50% could die. It's life-threatening as well. It's the comparison is between viral and bacterial. The bacterial, the all bacteria are they not like Neisseria, but usually one pneumococcal meningitis. It's a kind of invasive pneumococcal streptococcal pneumonia.
yeah.
It is a
Okay.
streptococcal invasive one. It's usually the
It's
patient. You need to take
it's
history from the
invasive,
patient.
but it's
The
curable. We are not talking about disease like TB. You might have resistance to drugs.
Dr. Ibrahim, you're right. But if in another scenario, this scenario patient already confused and he's tracheostomize,
Yes,
ventilated,
yes.
weakness. So there is already sequelae and complication happen.
Yes.
So
yeah,
don't
that's mean
expect
invasive and reach
exactly.
the
Yeah.
brain.
Yeah.
Okay,
Mm.
And
it's
no cure
usually
here. Mm.
I know there is
Maybe in
okay.
this scenario, yes, no cure. But maybe in
Aye,
another
especially
scenario,
this
we
year,
could
very clear, yeah, no
exactly.
cure.
Yeah, particularly, yes, particularly this
Okay,
scenario.
this is
Perfect. Yes.
you could give antibiotic to treat the life stream bacteria. Okay, and okay you could do that, but usually there is irreversible damage could happen. Is more than 50% will end up with irreversible damage. So the patient could have deafness, could vision problem, may be severely affected his vision, his speech, everything. It depends where is the
And, and
extension of the infection inside the brain. So it's
exactly.
just
And
meningitis, then invade the brain. So it will end up if it's treated early, it could give
exactly.
good recovery. It could if it's treatment but the patient already come with loss of consciousness. So we don't know how long he has been having symptoms in his house. Maybe 1 2 days with fever and neck stiffness, and no, we don't know.
Yeah.
It
So
depends on.
let's, yeah,
So
it
it's
depends on the
uncertain.
scenario.
Yes.
Exactly. It's depending on the scenario. If he's in coma, so say he is in coma, and by the way, he might die because of the confusion, aspiration, pneumonia, and blah blah blah, not because of the meningitis itself, but as a
Yes.
meningitis sequelae, it happened. So we are talking about every scenario individually. Don't
Yes.
do it as a rule. Exactly. Okay.
Yes. So just be uncertain. Just let her feel that there is no the reassurance is about reassurance of a team. We will do our best to help him only, but we can't predict how her her progression. It could be
Yeah,
progressed worse or no. It could be like that.
exactly.
It end up with permanent damage in his brain. So till this moment we don't know. But I want to just update you. What about his current clinical condition? He is on feeding, tube feedings, and he has like catheter. Okay, so and you said that it's catheter, NG tube feeding, and is confused and with weakness. Just update what exactly what's written in the scenario, and this is your
Perfect.
job only. And the outcome is uncertain. But usually with bacterial meningitis, the outcome is not good.
Yes, and you can say we will assess him day after day, and we'll let you know about every update. That's it.
Yeah,
If you want to make it again vague, as uncertain again.
yeah, and just let her
Yeah,
let her prepare to the permanent damage and what kind of permanent
yes,
damage that might end
yeah.
up with.
But the most
Yes,
important lesson, as Dr. Daria said, don't give false hope. So if not
yes,
written as recovered, don't say recover at all, and don't give any false hope. I
and
hope it's clear
even
now,
that
Dr. Daria. Yeah.
I prefer not to say even it's he is improved. No, he just said because they didn't mention he's improved. Just they put off of machine. Okay, and
Uh-huh.
still
Yeah.
confused.
Yes,
Just
exactly.
be aware. Oh, yeah, be careful on the word. And by the way, you've mentioned jargons many times. Poor prognosis. May be careful. And you've said ICU as Dr. Salma. Just if you mention just one time, this will affect your communication skills. And if you said absolutely, it will affect your clinical judgment a lot. And yeah, take care. Okay.
Yes, thank you, Dr. Daria.
Thanks.
I wrote here down in the chat box the prognosis, how to mention it without jargon. So you can see the outcome of the condition. Simply, to be as simple as much as you can.
I want to ask Dr. Dalia one question about the communication stations. And it seems it is the cornerstone of passing the basis as
No,
we
no, no, not
believe.
the By
Hmm?
the way, it's the long clinical consultation, the cornerstone, the long clinical.
All of my colleagues يعني failed two
No,
degrees, one
this is
degree.
another issue. It
كانت
could be
الكوميونيكيشن
nightmare. Yeah, it's nightmare is a different point. If you are not having the skills, this is a different. But the more and the main bulk of marks in the long clinical consultation, you might have half of the mark in the communication and the half in the next station communication. But if you got good mark in the long clinical consultation, you can still pass. I guess so. So, what's your opinion, Dr. Dalla?
Thank you, Dr. Bassem.
Could I get your question again, please?
He to ask about the communication is the most important station. If you failed it, you might fail the exam. I said no, it's not necessary to be failed in this because it's only five skills. But in the long clinical session, you have 7 skills. There is 8 marks different in both scenarios from long and both scenarios of communication. 8 marks.
Okay.
20 and 28. So my point is, if you fulfill the long clinical consultation skills and you got good mark, maybe let's say full mark or 2 marks minus, still you can have a good opportunity to pass the exam, rather than if you got full mark in the communication and you miss one station in the long clinical consultation. And this is what happened with me last time. I got full mark almost in the 2 communication station, but one station as long failed me. One station in long failed me because the mark in the long was a lot. As I
Could
said,
I
if you got a bad mark in the long, you might fail the whole exam. But the communication, I guess it's not going to fail you unless you have very bad mark and you didn't do anything in the station.
Could I do it my way? Okay, Dr. Ibrahim, it's the marking system in PACES exam is depending mainly on the skills. You have to master every skill, every single skill. So that you need to pass every single skill and to pass the score, the whole score. Okay, so usually candidate pass the score but fail one skills, sometimes two skills. Okay, so it's different from one to one. Some people have problem with communication, and some people have problem with the differential diagnosis. I know one of our colleagues failed the exam 6 times with differential diagnosis. Okay, skills. So, and the most people fail the exam because of communication skills, to be honest with you. Why? Because it's not because it's hard, because it's need to be, understanding what are understanding the communication itself. Okay, communication itself, it need to be read the mark sheet. Okay, I already shared it before. What to be satisfied and not satisfied. To be satisfied, for example, in your case, if you give the two examiner, if you said absolutely he's not gonna die, they will put for you that unsatisfied. For communication is for communication, for the clinical judgment, by the way. This
And let's
this is the
clarify, Dr.
skill of
Dalia, sorry
clinical
to interrupt
judgment.
you on this,
Okay.
but let's clarify. There is communication skill and there is communication station. And communication skill as a skill, it's present in the long clinical consultation and present in the communication station. So we are talking about skill and station. You have to know the difference because the communication station having marks for the communication skill, as well as the long clinical consultation. Also, it has marks for the communication skills. Clear now, Dr. Dalia, go ahead, continue.
Okay. So what I'm just okay. So in each station, you are be examined for the skills. As Dr. Basim said, the long clinical consultations, this is the bulk of the exam scores. Why? Because you've been examined for the 7 skills all together in one station. And you have 2 cases, so you will be examined twice for the all skills, which are 7 skills. So if you give uncertain and not accurate information in communication, so what the clinical judgment in communication station? The clinical judgment is that if the surrogate asks you about medical, for example, treatment plan,
Decision.
for
Yes.
the
Or
for
admission.
something, for
Yeah.
anything, if
Yes.
you are not accurate for prescribing it's written certainly by the consultant, or certainly this will affect your clinical judgment. Please, 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 all be careful for each word is written in scenario. Just divide your time while you're preparing outside. Read the scenario many times. Okay, if you are speedy. Okay, and just you could mark what is written. If you have any blood test or any investigation done, read it carefully. Sometimes, just not, it might ask you, what about my hemoglobin A1C, for example? What about, I want to know the result. Be prepared. Just copy the investigation, the name, the role, and just be prepared for the hidden. For example, if I said I saw this epilepsy, I will put that. If it's female, I will put pregnancy, okay, and an oral contraceptive. And I put for driving hobbies like this, because you are not, you just need to put thing, you need to mention it. Very important. Safety netting and like hobbies, pregnancies, and all. Just put that aside and put the information, exact information. Just mention, just exact. No added things. But by the way, Dr. Salma, in her case, added some that they will do for you some investigation. No, it's not mentioned that in the scenario. So please don't mention anything that is not written. Okay?
This is the
So
most irritating point. Inventing any invention from any
yes,
scenario, either long or clinical or communication. If you invent something, even the short station, if you invent something and you are talking overconfident, I heard a normal, and you are overconfident, or you added some lab test which is not written, or you said we did a test, or you, as Dr. Dalia said, we will do investigation. It might irritate the examiner, and whatever you do after that, it might harm, and he might cut your mark, whatever you do. So be
yes,
careful about inventing. Yes, I agree with that.
yes. Be careful for that. And for example, if what I gonna say, just do that the right thing you need to do, and usually what we're waiting from you to see how empathetic and how confident you are. Confident does not mean you don't know you have to know all the details. Just be confident that you are working like a team. You will ask the team. Okay? So confidently I could say, okay, I will check that with our team with very confidence that we are working like a teamwork. So it's not my decision. Okay? This is a teamwork. So give this impression. When you would like to say something, you didn't say, I don't know. Just I will, okay, I will consult our seniors or our team. I will ask our team, and so on, so on. So that is the way that you give the feeling of that you are confident, and you just ask your senior because you are working like a team. It's not like I don't know. Okay, and this is one of the skills that to say I don't know. Okay, so be confident, be accurate, be, for example, if it's critical and irreversible damage, say irreversible damage. If it's critical, say critical. If it's legal, say legal.
Yeah, yeah.
Sometimes they are looking for accurate sentence that will end up the conversation. So if it's say legal, the surrogate will shut up immediately. No need to say anything else. Explain or just to take time to explain. No, just it's legal. We'll apply it because it's unsafe for you and for others. Okay. Sometimes they said to you said that you might lose your insurance and so on. So, but many times you don't need to say that because legal. Okay, they will accept that immediately. Okay, and just for communication skills, avoid jargon, avoid confusing the patient. So there is a mark for to be systematic. For example, if as Dr. Basim said it's that breaking bad news, the steps, and they say the name of the disease, then explaining the disease, give some physiology if it's appropriate, and the pathology. It's short pathology because please don't confuse the patient. If you give the patient a lot of medical explanation, he is not gonna sit for exam to answer the pathology. So only he need to know where is the disease, what the nature of disease. Is it genetic? Is it inflammatory? Is it infection? Is it what? Okay, and where is the disease? Is it in the lung, in the brain? Where? Okay, so and the symptoms that to explain to just give a link between the symptoms and the pathology, and explain the complication. Complication is very important. Okay, and this is to be smart. Sometimes use it like in a smart way, particularly in the scenarios with the medication. The patient will start medication. The consultant decided to put the patient for example, anti-ischemic, anti-epileptic, anti. So when you will come to the complication, just say, just like writing him. So there is complication. They could happen. So to prevent that from happening to you, the consultant decided to put you on treatment. Could I explain what the plan of management for you, please? Okay, if he is following you, okay, so he could accept later, because he knows that there is complication, okay, and he just want to accept partially about that, and who could, be helpful. Okay, so if it's systematic, that's less confusing. If it's too much information, medical background, it will be confusing. And if I know one of my colleague that he just failed the exam because confused the patient in communication skills. He asked like something, he mentions two things contradicted. Okay, and just the surrogate is spent all the time, okay, just pressing on that point. Okay, and be careful not to mention anything that contradicted to the be clear to get the communication skills, be precise to get the clinical judgment. Okay, and yes, yeah, and avoid the jargon, please. Okay, thank you. Am I answer your question,
Who was asking, Dr. Ibrahim?
Dr. Ibrahim?
I'm the one who asked the question, by the
Dr.
way.
Ahmed. Okay.
Thank you.
Am I answered your question?
Yes, in detail. Thank you very much.
Okay, thanks.
Okay. Thank you, Dr. Dalia. Thank you, Dr.
Just a minute, Dr. Dalia. So in epilepsy, in this scenario, I was confused because I didn't put the main idea that it is clinical diagnosis, and it could be idiopathic, it could be genetic, it could be something. So I actually was confused. That's why I confused the patient, and that is the problem here. So when I discussed the disease for the patient, then she asked me, but the investigations came negative. So what could be the cause behind my condition? What is the perfect answer in this way, in this concern?
Okay,
Again,
that's
I think so.
yeah. Okay, Dr. Sarma. By the way, when you you mentioned that point, I just want to say, please flip the sentence to get rid of this kind of question. If, for example, if you said from the start to the patient, this is you have, I'm sorry to tell you that, and then breaking bad news, blah 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 blah. You have a disease called epilepsy. Have you ever heard about that? She said no. Okay, epilepsy is a kind of brain disease. It's usually there is a process of electrical impulses that making the brain not working appropriately. So it will give the symptoms like jerking movement and so and so and so. And this diagnosis is usually when we do kind of diagnosis, we need to exclude other causes of this jerky movement. So what we've done for you is to do scans, because sometimes there is some kind of tumors or some kind of disease might affect the brain and give this and give these symptoms. So we are excluding the most serious thing by doing the CT scan. It's normal, and other things like reversible causes of the kind of this jerky movement, which is I've done with the blood test, and all of them come negative. So that's mean we are, this is what you have is epilepsy, which is something there is no clear cause for that. It's just comes temporary electrical pulse of electrical activity in the brain, and so. And then when you said that, you will avoid this kind of question. So when the patient asks you about something, make sure that you are confusing the patient. If you feel that you are confusing the patient, just try to explain the symptoms. The symptoms of jerky movement are loss of consciousness, that there is most probably problem in the brain. Okay, so we've done this to know what the cause, and we exclude by this kind of investigation, we exclude some of the possibilities of your symptoms. Okay.
Okay.
Thank you, Dr. Dalia.
Okay, thank you, Dr. Dalia.
Yeah, for the explanation. Thank you. A special thanks to Dr. Salma, because she was volunteered to do the scenarios today, as well as Dr. Ibrahim, who was volunteered to start his practice with us. I hope you got the benefit from this session, Dr. Ibrahim.
Yes, of
And
course.
yeah, Yeah, of course, Dr. Salma, because she was trained on, but she didn't practice. Now she knows about epilepsy, how to do it in the
Yes.
professional. Yeah,
Yes.
hopefully, inshallah, all of us success in this exam soon. Any question before ending the session? Thank you, Dr. Adali, of course, and all the doctors commented in the chat box. Please, anyone has comment before ending the session?
Yeah, just to answer a question for Dr. Ibrahim, communication, which is very important in LCC. By the way, communication in LCC, it's mean the history. And you are making yourself
Yeah,
clear when
taking
you're
history.
asking, yeah,
Yeah.
and asking the important question, focused, targeted history, not,
Systematic.
yeah, focused, targeted history. Okay, so, and it's clear with no jargon, not confusing
Systematic,
the
Dr.
patient.
Dalia, because they cut for me a lot of mark because of systematic. He wrote in the comment on the feedback, systematic. He mean that I wasn't systematic. So I
Oh,
guess, yeah, it was
yeah.
one of the important points, systematic, from head to toe, not from toe to head or from haphazard or randomly. Not any question from any system. No, you have to be systematic in your
What do you mean
presentation.
by systematic? I didn't get you.
Yeah, system review, for example, you will not ask about the urine, then you'll ask about the headache, then you'll ask about the abdomen, then you'll ask about the
Uh,
vision. It's
I,
a systematic way from head
I
to toe.
guess I guess that they didn't mean that. It's systematic. It means, by the way, it's to do steps of analysis of the complaint after you finish the complaint, or if you, for example, um, um, if it start with the complaint that, for example, headache, you analyze the headache, that's the usual general analysis, and you got one of them positive, but you are you know the next question of after that is like that, for example, increasing, decreasing, and you find, for example, one of them positive, you need to go for the positive to ask for the positive thing until it's, for example,
No,
I
no,
could
no.
say,
It wasn't like that, Dr. Dalia, because I asked about the complication of diabetes, but not in an organized way. As I said, heart attack, then I said stroke. This is what I did, and I believe it's what the missing point. I did the
okay,
complaint analysis. So I think the complication or the manifestation should be systematic in a systematic way, not randomly asking.
okay, it's, by the way, I've done this way in my exam and I got full mark. So
Maybe examiner wise, I don't know, but
yeah,
he
if
gave
there is
me.
diversity, but usually means that when it started to get something, for example, if the patient has diabetes, said, since when you have the diabetes, ask the question of the diabetes, then go to the next step. Not, for example, finish that because you know that by your heart, to ask the question, the flow of question like that from head to toe, and then at the end you've just remember that you need to ask about what you've started about that, and it's like general general analysis. After that specific analysis, if you have a specific question about the disease, okay, or the complaint, for example, for dysphagia, um, it phase where the food is stuck and is it for liquid or for solid? This is specific question. So after you analyze the onset and the duration and you come to the specific question, then after that, if for the if there is severity of the symptoms or the flag symptoms, okay, red flags, and then the system involved, then you could go whatever you want. The general system is the most important to ask next, because here we'll catch the diagnosis. And then after that, you could ask the focus, because it's mentioned it's focused as well and targeted. You don't need to ask from head to toe. There is, in the mark sheet, it didn't mention that. This is, I don't know why this examiner put that for you. It's really weird.
Anyway, Alhamdulillah, we forget that attempt, and hopefully we'll pass in the next,
Yeah,
inshallah.
he's not fair with you.
Yeah, obviously he wasn't, because the
Yes.
mark, even it's not even reaching to the half mark. I think it
Yes.
was like personal issue. Anyway, again, let's forget what already passed and we will think
Okay.
about future, inshallah.
Yeah,
Thank you,
Yes,
Dr. Dalia.
yes.
Dr. Basim, big thanks for Dr. Dalia. She's giving us from her time and studying with us and
Yeah, I
correcting
always
us.
thank her.
Thank
Yeah,
you,
I'm
Dr.
always thanking
Dalia,
her.
so much.
Yes, of
Yeah,
course, we have
thank
to
you.
thank her. Yeah. Thank
Yes,
you,
Yes,
Dr.
don't say that. You're welcome.
thank
Thank
you.
you, Dr. Dalia. Thank you,
Pleasure.
Dr. Salma,
Thanks.
Dr. Ibrahim,
شكرا جزيلا
everyone.
يا
I
جماعة،
think,
كل سنة وانتم طيبين.
yeah, thank you. Dr. Ahmed, right? Thank you, Dr. Ahmed. So nice questions. It's a nice discussion. All the session was great, and we enjoyed the session with all of you. Hopefully, enjoy your weekend. See you, inshallah, on Saturday. Have a nice weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.